Pain specialist Grünenthal believes palliative care, enhancing the quality of life despite a terminal illness, is both a moral duty and a human right. For well over 2 decades, company shareholders and the Grünenthal Foundation for Palliative Care have been promoting research and support for people with severe or terminal diseases, for instance, by sponsoring a professorship at Aachen University. At the university hospital, they deliver comprehensive nursing care that really comes from the heart. They make the patients as comfortable as possible by managing pain and other distressing symptoms. But palliative care is more than that. It comprises psychological, social and spiritual support for the patients and their families. In Aachen, it also includes music and animal-based therapies.
Many people coming to our ward will not die here. About 40% leave our university palliative care unit and go back home. And they have a 7-day, 24-hour support of that palliative care home services.
In the Aachen region, as in all of Germany, palliative care can be provided in health centres, hospitals, hospices and at home 24 hours a day, 7 days a week. Specialist doctors and nurses and others such as psychologists, social workers, physiotherapists and chaplains ensure that patients experience the highest possible quality of life in the last phase of their lives. With ageing populations around the world, palliative care should become a public health priority. The healthcare professionals who provide this care must be equipped with the necessary knowledge and skills which go far beyond medical expertise.
I think education in palliative care, and especially education and communication skills, is the way to get contact and better openness to the patient and of the patient.
Even for Europe, the Aachen region has always been a pioneer in palliative care, establishing the first German hospice in 1986 and the first university chair for palliative medicine in 2003. However, the WHO estimates that 4 out of 5 people in need of palliative care live in low and middle income countries.
Palliative care and pain relief should be accessible for all people who need it. All. Women, children, everybody. At the moment, that is not the case, and there is a huge gap between high-income countries and low and middle-income countries.
Each year, almost 60 million people are in need of palliative care, and the majority can't access appropriate therapies. This situation is a call for governments and civil society to work together and strengthen palliative care within the healthcare system.
It is my wish that at some time in the future, palliative care is acknowledged as a human right. And this goes out to the decision makers. I would be very happy if all of them would take their responsibility to make end-of-life care accessible and achievable everywhere worldwide.